So I will speak about the gastric dilatation volvulus syndrome. We are going to cover today what happens in that GDV syndrome, what is the etiology, what are the clinical signs, how to diagnose this disease, and what happens postoperatively for the animal. So firstly, what happens? The gastric dilatation is a distension of the stomach, and the volvulus is the rotation of the stomach on its long axis. So the diaphragm and the caudal vena cava are compressed. Blood flow to the liver is decreased, so its ability to remove toxins from the blood is decreased too. So the gastric dilatation is a life-threatening condition that requires prompt treatment. It affects dogs, rarely cats, and guinea pigs. The most important factor in a favorable evolution is an immediate treatment. Here you can see the picture of a normal stomach on the left and of a gastric dilatation and volvulus in a large mixed breed dog on the right. This is an X-ray. What does it show? The pylorus and the duodenum are in an abnormal position cranial to the stomach. They are separated by a fold in the stomach, creating this double bubble appearance. And the large dark area is the gas trapped in the stomach. Then, about the etiology. When does it occur? When there is an exercise after food intake, after large meals ingested, and when the stomach and the esophagus have the ability to deform. The stress and the genetic origin are also involved, and this problem often occur in deep-chested breeds, which are especially at risk. About the clinical signs, the abdomen is painful and distended. There is a non-productive retching, which is like non-productive vomiting. How is it possible? This is because the most common direction for rotation is clockwise, viewing the animal from behind, and the stomach can rotate up to 360 degrees in this direction and 90 degrees counterclockwise. If the volvulus is greater than 180, the esophagus is closed off, thereby preventing the animal from vomiting. Then, cardiac arrhythmia and tachycardia are frequent. Animal can show signs of hypersalivation, a difficulty breathing due to the pressure of the diaphragm on the lungs, and of course depression and weakness. The dog might stand uncomfortably and seem to be in extreme discomfort for no apparent reason. How to diagnose that syndrome? The radiography is used to determine if there is a gastric dilatation and to confirm the diagnosis. Blood analysis is also commonly performed to evaluate severity of the respiratory compromise and the metabolic disturbances. Also, we can use electrocardiography. It helps to detect if there is arrhythmia, but keep in mind that at the time of presentation, about 1/4 of dogs have arrhythmia. In fact, some arrhythmia may not develop until 3 days after presentation. Before the surgery, intravenous fluids and oxygen therapy are required in most pets to stabilize them. During the surgery, if necessary, partial gastrectomy, the partial removal of the stomach wall, and splenectomy, the removal of the spleen, are performed. After the surgery, the intake of antibiotics to start before the operation is to continue if the mucosa of the stomach has been damaged. Finally, we will deal with the prevention of that syndrome. Recurrence of gastric dilatation volvulus syndrome attacks can be a problem. It occurs in up to 80% of dogs treated medically only, so without surgery. To prevent recurrence, a right-side gastropexy is often performed. Gastropexy firmly attaches the stomach wall to the body wall so that it prevents the stomach from twisting inside the abdominal cavity in the future. Other precautions can be taken. Small meals throughout the day and avoid exercise immediately before or after meal. Thank you for watching. Don't forget to click on the button subscribe just under this video. You can also like this video if you enjoyed it, and you can comment to add anything you think interesting. Bye!